Group 5. Therapeutic Recreation Foundation, Worksheet 6. Our team. Precious. Anime. Imperatrice. Documentation. Planning an outing is fun, however there are certain things that needs to consider in order to implement it. Here is a sample of what to consider in outing and its implementation. Learning objectives. 1. Identify focus areas of community outings including functional mobility, cognition, and family training. 2. Understand the psychosocial elements involved when completing community outings. 3. Confidently implement and/or simulate outings regardless of treatment setting barriers. 4. Competently document the distinct value of community outings for reimbursement and ensure carryover throughout the client's continuum of care. How to plan outings. MD order. Patient appropriateness. Medically stable, vitals from the night prior or morning of outing. Precautions. Pain levels. Agitation levels/social appropriateness. Understanding that they must return to the hospital/nursing home. Practice run outings. Interdisciplinary planning. Speech therapy for communication strategies to use. Physical therapy for most appropriate mobility equipment to bring. Recreational therapy for leisure interests to make it meaningful. Respiratory therapy accompanying if there are trach needs. Is a co-treatment necessary? Decide the mode of transportation. Ambulation. Push the wheelchair/have patients self-propel the wheelchair. Drive. Decide the appropriate duration. 60 minutes. 90 minutes. Decide the appropriate day during length of stay/appropriate time of day. Avoid reassessment days. Avoid catheterization schedules/timed medication schedules. Emergency preparedness and safety. Stock appropriate items in the car, JACHO regulation. Medical. First aid kit, stethoscope, blood pressure cuff, Band-Aids, gloves, water, sugar packets. Bowel, bladder, vomiting. Towels, briefs, sanitation wipes, gloves, catheter kit, urinal, emesis bags. Weather management. Call back to the hospital with charge nurse assistance to consider appropriateness of traveling back to the hospital versus calling 911 from current location. Codes. Will not complete outings during code browns. Sign patients in and out of the building so there is an accurate head count during code situations. Leave phone number available so if during an unsafe situation, they'll advise us not to return to the hospital, i.e. code red, active shooter. Have family members/caregivers that are participating in the outing meet at the desired location to ensure no liability issues, i.e. car accidents. Benefits of community outings. Mobility. Cognition. Family training. Realistic circumstances and realistic obstacles. Holistic treatment planning. Psychosocial support. Psychosocial components. Defining psychosocial, culmination of psychological, cultural, spiritual, social, and cognitive elements. Meaning. Purpose. Motivation. Symbolism. Relationships. Roles. Self-image. This may be the first time that people are in a wheelchair, using a mobility device, have wounds, limb loss, hair loss after surgery, weight changes. Not everything is perfect. We are well aware that not all situations are ideal, and not every location has funding/resources to make all treatment ideas happen. Our goal is to at least implant ideas of treatments that do take place out in the community so that they can be simulated, even if it is indoors. Thank you.